Dr. Howard Elkin is a cardiologist and a specialist in alternative health modalities. But when he suffered a heart attack in 2006 and 19 months later emergency unsuccessful back surgery, his eyes were opened. He's written a book about his experience called From Both Sides of the Table, in which he inspires people to become more proactive about their health and well-being, to become their own medical advocates.
Good afternoon. Now, you all know that I'm a doctor. I'm an internist practicing preventive medicine. I'm a cardiologist. I'm also an anti-aging medical specialist. Now, you also know that the doctor's word is generally regarded as golden, right? I mean, look at all the schooling and training that we go through. I mean, take me, for example. I went through 4 years of undergraduate school. Then I went through 4 years of medical school. Then I went through 3 years of internal medicine. Then I went through 2 years of clinical cardiology. Then I went through another year of interventional cardiology. That doesn't even include the training I've had outside of my practice the last 5 years in order to get a board certification in anti-aging medicine. That's a lot of schooling. So when a doctor tells you this is what you should do, you do it, right? I mean, you wouldn't question a pilot when you board a plane whether or not he or she has the expertise to fly, would you? No. So why would you question a doctor? Well, actually, the answer to that really is no. Resounding no. And I'm actually not here to convince you that the doctor's word is gold, but to show you how all of us can become a medical advocate, because that's what I've become. I'm a doctor, and what I said about my training was correct. But I go a step further. I'm a medical advocate, and that's what I want you to learn. Now, I wasn't always a medical advocate. I've always been proud of the relationships I've had with my patients, but it wasn't until I actually became a patient did I see the light. Now, I had 2 admissions to the hospital within a 19-month span. I'm going to tell you briefly about the first one. I awakened one morning nearly 3 years ago with what I thought was heartburn. Lasted for a few minutes, went away. About 2 hours later, I awakened with another bout of heartburn. This time it lasted about 15 minutes, and it was a little more intense. It went away. 7:30 in the morning, I awakened, got ready for work, went to work. About 11:30, I broke out in a cold sweat. Lasted about 15 minutes, went away. And I just went about my day. I just did my thing. And I actually went to the gym, worked out that day. And after my workout, all of a sudden, my arms felt like they were heavy or heavier than the weights I was actually lifting. Then I got a little worried. Up to that time, I was totally clueless. I wasn't even paying attention to my symptoms. I knew I had something wrong, but I mean, after all, I was in great shape, right? I was a bodybuilder. I'm a cardiologist. I don't have any risk factors for heart disease, and I have no family history. It couldn't be my heart. So I called my doctor because I was worried. He said, you better get to the hospital. I went to Cedars, and before you know it, I was whisked to the cath lab, and they did an emergency intervention, and indeed I was in the throngs of an acute heart attack. Fortunately, it was a life-saving procedure. Did great. I had no demonstrable damage to my heart. 2 days later, the doctor discharged me and said, you know, you're in great shape. You got nothing to worry about. That's when I knew I had something to worry about. Because this time I was the one that was clueless. This time they were clueless. Because the medical profession didn't talk about stress. They had nothing to offer me. I had to actually rehabilitate myself. I was swimming in stress at that time. I was overwhelmed, I was irritable, I was anxious, and I was downright depressed. So I had to take in the reins. I had to become my own medical advocate and really make some choices and changes in my life. I took up daily meditation, 10 minutes a day before I got out of bed each morning. 5-minute nightly prayer. Then I did some mindfulness training. And these simple practices really have helped me through today. And it was really nice because it got me through 19 months later when I underwent emergency back surgery. But again, it wasn't until I became a patient that I become a true medical advocate. And that's why I wrote my book, For Both Sides of the Table, When Doctor Becomes Patient. We've been talking about the MAP, Medical Advocacy Principles. So just to recap, number 1, don't feel compelled to make an instant decision when your medical professional says you have to have something done, unless you're in the throngs of a heart attack or unless you've been in an auto accident and you've crushed about 3 or 4 bones. Number 2, be in touch with your body. Very important, and that's what I had to learn when I had my heart attack. I was totally clueless before that. The third principle is follow your instincts. Even though a medical professional may be highly qualified, that doesn't mean it's the right match for you. So if you don't feel heard, if you don't feel like the doctor is answering your questions, it's time to leave and find someone else that can help you. Has anybody here experienced an episode in which they've gone to a physician and they just weren't satisfied with the information they got? They thought it was as if it was incomplete? Anybody?
I have.
Yes.
I've recently been undergoing some episodes. I've had heart palpitations. I've lost a substantial amount of sleep. I've currently gone to a cardiologist a few weeks back. I've undergone a myriad of tests. When the doctor concluded, and I went into his office, he indicated, Mary, we've got good news and bad news. Your good news is your heart is fine. Bad news is you're going to have to live with it. Needless to say, it's kept me, I feel quite empty. Do you have any suggestions?
Wow. You have to live with it. Has anybody heard that before? Who here wants to live with pain, emotional or physical? I don't. I'm going to do everything in my power to alleviate that pain. So she wasn't happy with the response she got, and for good reason. First of all, it's good that he did do appropriate cardiac testing to rule out a cardiac cause. But about 90% of palpitations have nothing to do with the heart anyway. So what about her hormonal situation? Is she low in progesterone? Food allergies? How about her stress? How much sleep is she getting per night? These are so many important things that the doctor probably didn't ask you about. Right, so we have to find a pattern so that Mary can have some solution to her problem. And that's what partnering is all about and becoming a medical advocate.